Welcome to a new episode of Weird History of. Today, our topic is medicine. Before modern hospitals, before sterile gloves, before anyone thought to maybe wash their hands, medicine was basically a mix of guesswork, vibes, and this might kill you, but let's find out. For most of human history, if you got sick, the treatment options included leeches, mercury, drilling holes in your skull, or being prescribed literal cocaine. Yes, real cocaine. By doctors. In a pharmacy. Medicine wasn't always science. Sometimes it was superstition. Sometimes it was straight up medieval chaos. And sometimes it worked just enough to make people keep doing it. Ancient physicians believed disease came from bad blood, evil spirits, or your body having too much personality. So naturally, they tried to fix it by bleeding you, purging you, or attaching animals to your face. And here's the wild part. Some of the weirdest treatments actually led to real breakthroughs. Others absolutely did not. Today, we're diving into the strangest, most unbelievable chapters in medical history. The cures, the experiments, and the procedures that make modern healthcare look like a luxury spa day. From doctors prescribing cigarettes, to surgeons operating without anesthesia, to Victorians using vibrators as medical devices, this is the weird history of medicine. And trust me, by the end of this episode, you will never complain about a flu shot again. Let's get right in. Please consider subscribing if you enjoyed this video. For thousands of years, if you went to the doctor feeling sick, weak, or slightly off, their solution was simple: remove your blood. This practice was called bloodletting, and it was one of the most popular medical treatments in human history. Got a fever? Bloodletting. Headache? Bloodletting. Broken bone? Honestly, probably still bloodletting. Ancient Greek doctors believed the body contained four humors: blood, phlegm, black bile, and yellow bile. If you had too much of one, boom, illness. So naturally, the cure was to drain some of it out like a very questionable oil change. Doctors used knives, cups, and of course, leeches. Lots of leeches. So many leeches that Europe once experienced a leech shortage. Imagine being in a medical emergency and the hospital saying, "Sorry, we're out of worms." One of the most famous victims of bloodletting was George Washington. When he got sick in 1799, doctors removed nearly 40% of his blood in a single day. He did not recover. To be fair, bloodletting occasionally helped with conditions like high blood pressure, but most of the time, it just made patients weaker, and significantly more dead. Still, doctors kept doing it for over 2,000 years, because nothing says medical confidence like removing the exact thing keeping someone alive. Want to hear more? Imagine having a headache, and your doctor saying, "Don't worry, I'm going to drill a hole in your skull." Welcome to Trepanation, one of the oldest surgical procedures in human history. We're talking Stone Age old, as in before written language, before metal tools, before anyone really knew what the brain did. Trepanation involved cutting or drilling a hole directly into a person's skull. Why? To release pressure, to let out evil spirits, to cure headaches, seizures, or what doctors described as bad energy. And here's the wild part. Archaeologists have found ancient skulls with clean, healed holes, meaning people survived this. Some patients even had multiple holes, which suggests they either trusted their doctor deeply or made some truly questionable follow-up appointments. The procedure was performed across ancient Europe, South America, and Africa. Different cultures, same idea. If something's wrong inside the head, maybe let's open a window. Surprisingly, in certain cases, trepanation may have helped relieve pressure after head injuries. So while it sounds like pure horror, it wasn't always completely useless. Still, the idea of prehistoric brain surgery without anesthesia or sterile tools really makes modern medicine feel like an upgrade. Next time you complain about a dentist visit, just remember, at least they're not installing skylights in your skull. Next, let's talk about mercury, the cure that slowly poisoned you. For centuries, doctors looked at one of the most toxic elements on Earth and said, yes, let's eat that. Mercury was once considered a miracle cure. Feeling sick? Take mercury. Skin issues? Mercury. Syphilis? Definitely mercury. In fact, for hundreds of years, mercury was the go-to treatment for syphilis across Europe and America. Patients would rub it on their skin, inhale mercury vapors, or swallow it in pills, which did sometimes kill the bacteria, by also slowly killing the patient. One popular medical saying at the time was, "A night with Venus, a lifetime with Mercury." Romantic and extremely concerning. Mercury poisoning causes tremors, memory loss, hallucinations, and tooth loss. So patients would show up with symptoms, and doctors would prescribe more mercury, which made the symptoms worse, which led to more mercury. It was essentially a medical feedback loop of bad decisions. Even royalty got the treatment. And if you're wondering whether anyone noticed the connection between mercury and dying, eventually, yes, but it took a few centuries. To be fair, mercury does have antimicrobial properties, but the margin between helpful and catastrophic was basically non-existent. So the next time you see a warning label that says "do not ingest," just remember, there was a time when that was literally the prescription. And if you think that's shocking, there was a time when going to the doctor for breathing problems might result in them handing you a cigarette. In the late 1800s and early 1900s, cigarettes were actually prescribed as medicine. Doctors recommended smoking for asthma, throat irritation, stress, and even weight loss. Some brands were literally marketed as health products. Advertisements showed smiling physicians in lab coats, saying things like, "More doctors smoke this brand than any other," which is a sentence that aged spectacularly badly. Tobacco companies worked hard to position cigarettes as soothing, calming, and medically approved. There were even cigarette brands sold in pharmacies. To be fair, nicotine can temporarily open airways and create a relaxing effect, so early doctors thought it helped breathing. What they didn't fully understand yet was the long-term damage. By the mid-20th century, research began linking smoking to cancer and heart disease. Suddenly, the same product once prescribed by doctors became one of the biggest public health warnings in history. But for decades, lighting up wasn't just normal, it was recommended. Imagine going to a checkup today and your doctor saying, "You should try smoking, medicinally." The waiting room would get very quiet. Medicine evolves, and sometimes it evolves away from things that were wildly, hilariously wrong. And now, for every woman's favorite part, the vibrator, a very serious medical device. In the 1800s, doctors diagnosed thousands of women with a condition called hysteria. Symptoms included anxiety, irritability, insomnia, and basically having emotions. The treatment was for doctors to manually massage patients until they reached what medical journals described as a therapeutic release. This was considered legitimate medicine, very serious, totally scientific, absolutely not awkward at all. The process was time-consuming and, for doctors, physically exhausting. So in the late 19th century, someone had a bright idea. What if we invented a machine to do this instead? And just like that, the electric vibrator was born as a medical device. It was one of the earliest home electrical appliances, arriving before the vacuum cleaner and the electric iron. These devices were advertised in respectable catalogs as tools for health and relaxation. No one publicly acknowledged what they were actually doing. Everyone just politely understood. By the early 1900s, vibrators were being sold for home use, often described as personal massagers for wellness. Eventually, as cultural attitudes shifted and people became more honest about their function, they quietly disappeared from medical catalogs. So yes, one of the first widely adopted electrical medical devices in history was invented because doctors got tired of doing repetitive work by hand. Medicine has come a long way, but this chapter remains medically fascinating. So after all of that, leeches, mercury, skull drilling, cigarette prescriptions, bloodletting, and relaxing medical inventions, modern medicine suddenly feels pretty great. Today, if you go to the doctor, there's a very low chance they'll try to remove your blood, poison you with heavy metals, or hand you something glowing and say, "Drink this, trust me." Medicine didn't become advanced overnight. It took thousands of years of trial, error, and a lot of very questionable decisions. But every strange treatment, every failed cure, and every bizarre experiment eventually led to better science, better understanding, and better care. So the next time you get a vaccine, a routine checkup, or even a prescription that actually works, just remember, there was a time when the alternative involved leeches and optimism. History is weird, medicine is weirder, and somehow, humanity survived all of it. If you enjoyed this deep dive into the strangest chapters of medical history, stick around for more episodes of Weird History of, where we explore the moments in history that are equal parts fascinating, ridiculous, and slightly concerning. Subscribe for more strange stories from the past, and let me know in the comments, which historical medical treatment shocked you the most? Because honestly, we didn't even cover all of them.